Okay, we are working with Dr. St. Romain. We're doing our little SERP question sample. It is September 19th, and this is SERP 6, Session 7. Okay, got a few little questions for you, Dr. St. Romain. The first question is, why is it important to operate in the United States?
Well, this program offers the ability to care and look after your patients on a long term. I had previously looked at another program in the Dominican Republic where you went there for 1 week and placed implants. Here I find that you're able to follow up on your patients and see the results. So that's my benefit.
Okay. Why is it important to operate on those live patients?
As opposed to doing pig jaws, or I've done plenty implant courses, and I've never had anything that's even come close to the experience I've had here. There's just nuances in surgery that you're going to see that you will not be able to, nobody's going to be able to tell you, or there's not going to be a picture or anything that will give you that experience of actually having a live patient to work on.
Okay. How beneficial is it to learn under the experts such as Dr. McCracken and Dr. Rosensteel?
The two guys are probably the best dentists I've had the opportunity to work with, and it not only in implant dentistry but in oral surgery and prosthodontics. There's just such a wealth of information that I've gotten from both those guys that and they do it in a really relaxed atmosphere.
Okay. Let's see. What benefits do you foresee by having taken the SERP course?
Well, prior to coming here, I had limited oral surgery experience. I enjoyed it, but not really a lot of experience. And since I've come here, I feel a lot more comfortable with doing some of my surgeries now. Just plain, complicated extractions or apicoectomies, and obviously with implant surgery. I just feel like it's opened up a lot more opportunities for me to make diagnoses for my patients that I think are in their best interest.
Okay. You did place dental implants before, correct?
I did.
Okay. How much new information or techniques did you learn by going through the SERP program?
Well, it's just given me so much more confidence to go after cases that I would have never thought about going after. I don't know what percentage of new information, just the fact that you get exposed firsthand, and being able to do these cases and do them more than once gives you the ability to maybe try some of these more complicated cases, like I said, that I would have never even thought of doing in my own private practice. But now that I've taken it, I'm doing some of these.
How is SERP different from the other dental implant courses? You said a few things. Is there any other points?
Well, I looked for quite some time and thought I was trying to find a course that actually did some live surgery and just not viewing surgery. And this was the only one I found. And then when I talked to the director, and he explained that you're going to be doing, sinus lifts and lateral augmentations and maxillary ridge splits, I really thought he was pulling my leg. And sure enough, you get here and you're doing these things, and there's not anybody that holds your hand. Now, if they want, somebody can hold your hand, but they give you a lot of autonomy here to proceed. But we discuss cases prior to it, and they make themselves very available throughout, not only pre-operatively but during the surgery.
Can you tell us about the clinic and the staff?
That's been a great blessing to me. Staff is well trained, and it's been a pleasure to work here. I look forward to my 3 days when I come here.
Great. Is there anything else you'd like to add? Just any comments at this point?
Well, you know, I have kind of a smaller rural practice, and I don't make a whole bunch of money, and so an investment of this type was a big decision for me. And looking back at it, there's just no other continuing education that has even come close to what I've gotten out of SERP.
Okay. Thank you very much for
All
your
right,
time.
man.
Awesome.